Hi there, I'm Dr. Bill Crounse, Senior Director for Worldwide Health for the Microsoft Corporation in Redmond, Washington. As you might imagine, a number of my colleagues ask me all the time about electronic medical records and what they should be thinking about for their practice. So let me share with you 6 tips that I tell my friends and colleagues about what they should be looking for. First and foremost, interoperability and certification. The good news is that a public-private partnership has come together. It's called the Certification Commission for Healthcare Information Technology, and it exists to certify electronic record systems for a certain level of interoperability. It's a way of future-proofing that what you're buying is going to not only interoperate with other systems, but should be good to go for many years to come. So that's important, number 1. Number 2, I like to say take a look at the user interface design. How intuitive is it? I like applications that are very web-like. I sometimes will use the analogy of airlines and the fact that you can go on the web to any airline and you simply know how to buy a ticket. You want an electronic record system that works more like that. I know that's oversimplifying, but basically you want something that doesn't take a lot of training, that you can just get up and running right away because it is so intuitive in its design. Next, data input options. What do I mean there? Well, one of the real barriers to clinical adoption of IT is data input. I mean, computers and software are great for helping us access and search through volumes of patient data, but at the end of the day, you have to document. You have to enter data into that computer. So there are times when, yes, a keyboard, like the one I'm using here on my desktop, is perfectly appropriate for that. But there are other times when you might want to think about digital inking. You might have a tablet PC like this one. You want to pick up the pen. You want to be able to digital ink on a tablet PC. You might want to use a web-like application, and so you're doing a lot of point and click. That's another data input option. And finally, you might want a solution that allows you to do speech to text or speech transcription kinds of data input. You really ideally want software that can handle all of those kinds of data input options. Next, mobility. Mobility in healthcare is paramount. It's so important. I say if it's not mobile, it doesn't work very well. Why? Well, as doctors, we move from room to room, we move from office to hospital, maybe we have more than one office. You want software and applications that can travel with you. So in other words, things are going to need to work on your desktop, on your laptop, on a tablet. Here's another great tablet, this one from Tablet Kiosk. It actually even has a touch screen on it. You might want to be, when you're hospital rounding, using a device like this, or a PDA that's actually a phone, and you might want to use a smartphone like this one at times if you're out to dinner with your wife or something. So the bottom line here is you want software that extends itself to all of those applications, doesn't lock you down just to a desktop or just to a laptop. That's important. Then think about integration with your practice management system. I know a lot of you have older systems. You may be at a point where you want to buy something bundled that's both an electronic medical record and practice management system, but that's an important question to ask. And finally, ask about total cost of ownership. It's not just purchasing the software, it's the service, it's the upgrades, it's the long term of this. One of the good things that's happening is as global technology companies like Microsoft and others get more and more into this business, we're starting to see a lot more commodity components that our partners and vendors are using to build their solutions. That has the effect of commoditizing and driving down the price. That'll be good news for everybody because, quite frankly, solutions that cost $20,000 and $30,000 a seat or more aren't very practical, particularly in primary care. So we're looking for solutions that cost much less. So I hope that's helpful in getting you to start thinking about a solution for your practice. If you haven't gone digital, time is running out. You're going to need to go digital over the next couple of years at the very latest. So I hope you'll keep those tips in mind. If you have any further questions, you can refer to some of the resources I have online at www.microsoft.com/healthcare, and also check out Health Blog. Just search Health Blog, all one word. Have a lot of information out there for you. So until next time, for all of us at Microsoft, I'm Dr. Bill Crounse. Thanks for watching.